Introduction to Sample Collection and Pre-Analytical Best Practices, General Concepts. At the end of this training, learners should be able to understand laboratory workflow cycle, elements of quality assurance in pre-analytical best practices, management responsibilities in sample collection, technical responsibilities in sample collection, role of phlebotomists, signage in sample collection area, and quality indicators. Dealing with a huge inflow of patients, managing queues, and handling data of such magnitudes can be a daunting task, but not impossible. The laboratory workflow cycle consists of three phases: pre analytical, which includes before testing, analytical, which includes testing, and post analytical, which involves reporting. The pre-analytical phase, which deals with good sample management, is essential to accurate laboratory diagnosis, influences laboratory efficiency, and directly affects patient care and outcome, leading to a good public face of the laboratory. Process mapping in the pre-analytical process would include listing of activities involved in the process, how the flow of these activities should be arranged, who is responsible and for what, how success of the process can be monitored, and finally, understanding hazards in the process and ensuring safety. Defining activities in the pre-analytical phase. It includes test selection by the clinician or others, prescription or a test request form, registration which includes service agreement and unique identification of patients, pre-collection activities which involve information to the patient and patient preparation, sample collection, accessioning, sample preparation, sample transport, and biomedical waste management. The activity flow should be unidirectional in arrangement. It should be ensured that incompatible activities are not clubbed. For example, there should be a separate sample collection area. Enable optimum efficiency in every step. For example, providing signage posters, a sample collection manual or SOP at all points of collection, convenient positioning of the posters, well equipped phlebotomy stations, a well planned transportation system. Consider gender or disability sensitivity. Comply with government and statutory requirements. The unidirectional workflow of the pre-examination processes includes examination ordering, followed by registration, sample collection, followed by sample transport, the receipt of the sample and accessioning, finally biomedical waste management. Key elements of quality assurance in pre-analytical best practices include: first and foremost, education and training, standard operating procedures, correct patient identification, traceability of sample, good quality of sample, safe transport and storage, an incident reporting system, and finally hepatitis B immunization and testing for protective anti-H-based titers of all lab personnel. Education and training is necessary for all staff carrying out pre-analytical activities. It should include an understanding of anatomy, awareness of the risk from blood-body fluid exposure, and the consequences of inappropriate sample collection technique leading to poor infection prevention and control. Standard operating procedures are required for each step or procedure. They should be written, read, and understood by designated laboratory staff and be readily available to all healthcare workers involved in sample collection. Identification of patient should be through matching with the laboratory test request form, also known as TRF, with a minimum of two patient identifiers which should be positive. After samples have been taken from a patient, a system of identification and tracking is essential to ensure that the sample is correctly matched with the result and with the patient or the donor. Traceability of sample, unique numbering or labeling should be carried out to track back the sample to the correct patient. The quality of report generated by the laboratory always depends on sample quality. The sample should therefore be maintained in proper condition that would result in necessary preservation in order to ensure that the quality of the results are satisfactory. Proper packaging, safe transportation, and appropriate storage of biological samples will ensure improved quality of test results and overall safety. A system is required for reporting all adverse events. A logbook or register should be prepared with accurate details of the incident, possible causes, and management, also known as corrective action and preventive action of adverse events, should be recorded. Documentation of status of hepatitis B immunization is mandatory. Of key importance in pre-analytical activities is to ensure who does what, to define responsibilities and job description of the management and the technical staff. The management responsibilities in primary sample collection include provision of space and equipment, record keeping, and infection control facilities. In provision of space and equipment, the management should ensure that there is a separate primary sample collection facility, a washroom, waiting area, drinking water, etc. for comfort of patients and attendants should be there. A bed or a couch should be available in case of vasovagal attack. A first aid kit should always be in place. Record keeping. The laboratory's instructions for pre-collection, collection, and post-collection activities should be properly displayed. Documentation of needle stick injury or exposure to blood and body fluids should be there. Infection control facilities should be proper. The design of the laboratory should ensure safety of occupants and minimize risk of injury and occupational illness. Sufficient supplies of PPE, soap, water, alcoholic rub should be ensured by the management. An availability of post-exposure prophylaxis and a proper PEP protocol should be in place. Technical responsibilities of the supervisory staff. They should ensure that the manual for sample collection is available at all collection sites. All phlebotomists, nurses, doctors have to be trained in the SOP and have an easy access to it. Reporting of non-conforming events has to be made available. They should also ensure that a periodic training, regular supervision, and competency evaluation with adequate records is maintained. Technical responsibilities and role of phlebotomists. They should ensure correct ID of patient by confirming at least two unique identifiers, ensure adequate patient preparation, informed consent except in emergency situations, maintenance of confidentiality, correct specimen collection, mixing, and labeling, ensure that the integrity of the sample is maintained, and finally, addressing verbal test requests as defined in the lab's SOP. For samples withdrawn outside the laboratory, the phlebotomist is responsible for checking the suitability of the sample for testing and applying sample rejection criteria as per lab's policies and requesting repeats. He should also follow safety practices, avoid contaminated phlebotomy equipment, and also conform to dispose biomedical waste as per guidelines. The following signage are encouraged in the waiting areas, preferably in local language. Room number, inquiry room, name and contact, information of laboratory in charge or director, list of services excluded, directory of services, patient preparation instructions, instructions for patients, collected samples, turnaround time, rate list if applicable, and directions to the washroom. The following signages are encouraged in sample collection areas, preferably in local language again. Restricted entry, the biohazard sign, order of draw of sample, instruction for biomedical waste management. The spill management protocol should be displayed, preparation of 1% sodium hypochlorite solution, needle stick injury with contact details for post-exposure prophylaxis, counseling, testing, drugs and follow-up. So, to summarize, how do we decide that the pre analytical processes of the lab are in place? This is done by establishing quality indicators like identification of samples, number of mislabeled or inadequate identifiers, sample traceability, that is number of samples which cannot be traced back before or after analysis, the quality of samples, number of samples hemolyzed, insufficient quantity, clots in anticoagulated tubes. Finally, safety, number of needle stick injury incidents, spills, improper biomedical waste management incidents in the laboratory. Thank you.